I want to focus now on one bona fide population-based approach to reducing suicidality. And this is a study that's been going on for decades. It's a study that NIMH funded in its early days and is continuing to pay off. So there are a lot has been known about the use of early intervention, school-based and otherwise, in young children, and a lot of evidence suggests that these kinds of interventions can have broad-based protective effects against mental illness and substance use. And one of these interventions that has a lot of evidence behind it is the good behavior game, which is played by kids in their first and second grade, and as shown in this graph here, has long-term effects, not just what we already knew in terms of reductions in rates of mental illnesses and substance use, and by the way, also criminality. But here, what we can also see is reductions in suicide rates. So here's a control group in the blue dotted line, and in both females. This is women, so these are kids who played it in first and second grade, and we're now following them up in the late teen and early adult years. And you can see that those who had the good behavior game early in life have dramatically lower levels of suicidal ideation, whether they're female or male. Now, this study wasn't powered to detect things like suicide attempts or deaths by suicide, but a really surprising result is that a result of this game later on, more than 10 years later again, after they had the game, you see a reduction in all-cause mortality in these kids. Now, that could be from a number of different reasons, and it could not isolate out suicide in particular. But we can honestly say that these early population-based preventative interventions can have significant effects on suicidality and on all-cause mortality and other forms of morbidity. So we can say that these population-based solutions have clear evidence in support of their use.